Hi, I'm Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome back to Health Futures, and today I have a special guest here with me. It's been a while since I had you on the show. Can you believe it's been 3 years?
No.
Jasmine Bhatti. She is the founder and CEO of Navi Nurses. Welcome back to Health Futures.
Oh my gosh. Thank you so much, Bob, for having me. I can't even believe it's been 3 years.
I know, right?
Yeah, that's crazy. Time
And
flies.
I've known you for about 4 years, and I must say that I admire you for so many things, and we're going to get into them. But not only the fact that you're a nurse, but you're an entrepreneur.
Yeah.
And I want to talk about that journey as well. I mean, you are somebody that has really taken the stage from being bedside to really being an advocate and really changing the way healthcare and, more importantly, the way nursing is being delivered.
Yeah, it's been an exciting journey. And, I think not only is there beauty in building the company and running this business, but, as you know, your daughter's a nurse. I want other nurses to see that there is someone else who's doing it, who's been there, right? And showing them what's possible. Like 5 years ago, I was working in a hospital taking care of patients. Now I'm running an Inc. 5000 company, and I just made the Inc. 500 female founders list here. And
I love that.
It's like a dream.
Congratulations.
Thank you.
And these accolades are amazing, but they don't come without hard work.
Right.
And, for me, I look at what you're doing as, and you're transforming the way healthcare is being delivered. And that's, to me, something that I love, not only what Navi Nurses is doing, but we're in an inflection point right now. We are in a space right now that I like to refer to as a liminal space between what was and what it's about to be. And you're there right on the cutting edge.
Yeah, I think we're both there together, which is really exciting.
It is. It really is exciting. So here we are, fast forward, 3 years ago, you were here on the show, and now you have, I think it's about 160 nurses.
Yes.
And you are specializing in care delivery in the home.
Exactly.
In Maricopa County right here in Arizona.
Yeah, we're just here, which is, when I think about it, we've been able to double almost every year. And last year we provided over 42,000 hours of care just here in Phoenix. And
Wow.
It's remarkable because we really haven't done a lot of marketing. It's really been word of mouth, and most of our referrals come in from case managers and hospitals. But now we've been able to really refine our processes enough that hopefully we can begin to scale, as there is a huge need for what we're doing around the whole country and even around the world.
We talk about transformation, and you and I have the distinct pleasure of being on the advisory council or advisory board for the HEAL Lab. That is the Healthcare Entrepreneur Accelerator Lab that sits inside of the ASU School of Innovation in Nursing, which you are a proud graduate of. And I believe you've got your master's, and you're certainly right now about to get your doctorate.
I know.
ASU School of Nursing.
I need to just write it.
I'll be ready to call you Dr. Jasmine very shortly.
Yes. Yeah. Hopefully by the end of this year.
But that is exciting. So, for me, that HEAL Lab, that is really kind of the beginnings of where Navi Nurses was. This is this HEAL Lab that has been created, and our friend Rick Hall, he oversees that, or did oversee that. Michael's overseeing it now. Michael Collins. They help students take ideas and bring them to fruition. Can you talk a little bit about that? Because you were actually not only on the board, but you participated in that as well.
Yeah. So actually, I'm a PhD student at ASU, right? That struggling student. And as a PhD student, you have the opportunity to either teach and or do research to help offset the cost of tuition. So I decided to teach. And for one of the classes, I was teaching ASU 101. there was a day that we had to go and explore the Heal Lab, and I'd never been exposed to before. And I walked in, and that was my first time meeting Dr. Rick Hall. And I sat my students down, and they were listening to him, and he's describing all these amazing innovations happening in healthcare. And he was like, "If anyone has questions or ideas, please come see me." And I was always the nurse in the hospital writing things down like, this is a problem. Why do we do things this way? Like, we need a solution for this. So I had three really like solid ideas for what I wanted to do. And I went in after that day. It was probably like a few days later. I had emailed him and he's like, "Yeah, let's set up some time." I come into his office less than a week later and I was like, "Here are my ideas." And he was like, "Great. Let's get you plugged in." And everything just like compounded. So I was exposed to ASU Venture Devils, which is an organization that it's a actual academic semester that you spend learning about business development. And at the end, there's a pitch competition. So I signed up for the course credit and then pitched and actually won our first $10,000 from ASU Venture Devils. And when we received that, then it just kept opening door after door. And it's been just like a whirlwind. So everything for me 100% started with the Heal Lab. And for someone in healthcare, especially for nurses, we're not always heard. And we can have ideas, but they don't oftentimes go anywhere. So to have someone that was like, "This is a great idea. You have permission, and here are some resources." That's exactly what Rick Hall and the Heal Lab helped me with.
And the thing I love about the Heal Lab is, we won't name all the other board members, but they come from various disciplines, whether it be technology, healthcare. I mean, they're there helping these students bring their ideas to fruition. You and I just sat on one about a month ago where, this robot that they were sharing with us, while its application wasn't exactly designed for what they intended, there were various other applications for their tech and their innovation.
Yeah, absolutely. And I think that's why that's a great place for them to come to
Right.
because they're still learning and they're creative and they see the opportunities. They don't know yet enough about the entire circumstances surrounding, is this really feasible? How can it be feasible? And by having a variety of people around them to help say, all right, this may be a dead end here, or this is the path that we would recommend, then at least it helps them really kind of navigate what those next steps should be and where they can really explore taking their idea too. And I guess that's the journey of being an entrepreneur in general. Is it's I have a mentor that says it's a pick your own adventure, and the I think the foundation is just trying to open all the doors and then pick which ones you walk through.
So, for our listeners and our viewers who didn't hear our show from 3 years ago, can you take us back to the beginning? What was happening in your life when the idea of Navi Nurses came to fruition or came to life?
Ah, well, I think it started even before I was a nurse. So I experienced firsthand what it's like being a family caregiver. And I was in college. Actually, I'd always known I wanted to do something big in healthcare. I didn't know what that would look like. So I assumed that how do you make change at a really big level? It's through policy. So I was actually applying to law school and with the intent of going into health policy when my grandmother was diagnosed with head and neck cancer. And for people who don't know much and they're not familiar with it, it can be quite devastating to a person. So my grandmother was breathing through a hole in her neck. She was getting her nutrition through a tube in her belly. And we gave her 24/7 nursing care essentially at home as just family members. And that taught me how we're sending people home from the hospital, not necessarily giving them the resources that they need. And the really important thing I realized was that home health, what's covered by the insurance companies and the government, is a one size fits all. It's based on your insurance, this is what you get. And it's rarely enough for people. And that's really why we see people getting readmitted. We're not giving them the resources. And so I became a nurse, just inspired by the whole experience of caring for my grandmother. When I became a nurse, my patients were always tugging at my scrubs, like, "Will you come home with me?" And I realized that what I thought was unique to my family and I, that maybe there was something wrong with us, like we couldn't do it. It was truly, in fact, a problem for millions of other people. Like, we sign up to be a family member. We don't sign up to be a nurse or a caregiver for them. I think care can be experienced in multiple ways. But the best care we can give our loved ones is being present for them as the family member and letting other people come in and help with so many of the other aspects of care that are needed. So that's kind of how it started. And just, I was burnt out working through COVID. And obviously, it was kind of like, all right, do I take these crazy travel contracts where I make $10,000 a week working in New York and like really lose my soul? Or am I going to take this idea and try to run with it? And so I obviously took the idea, and it's been like, yeah, it's been a journey since then.
Well, it's amazing to me how you guys have grown. And for me, this was personal for I
Mhm.
mean, you saw the gap and you said, "Hey, we got to fix this."
Yeah.
And that's what I love about you. So here we are 3 years later. You
Yeah.
know, what does Navi Nurses look like today versus what it looked like 3 years ago?
Well, I can tell you in the beginning, I was the one taking care of all the patients and, doing the bookings and organizing. So I've really built every single role. And, last year was a really transformative year for us. So we went from 2 employees to 19. And
Wow.
that was like such a relief for me because for the first time, I can really sit back and dream and continue to move forward with all the areas that we see we can move into while letting people come in and do the things that they're really good at. So I don't have to do that work anymore. And now I can really just focus on how do we take this incredible impact we're seeing on nurses and patients here in Phoenix, and how can we help expand that around the country? And I think 3 years ago at the time, we had just won a grant. So we won a $1.5 million grant from the
Yeah.
Nurses Foundation.
Yes.
And part of that was to understand if nurses are present in that very transition from hospital to home, what what impact does that have? And we studied both the nurses and the patients, and we had planned to actually study the caregivers as well, their family caregivers. But there was one really significant observation that I made. And we would walk into these rooms with people and sit down and say, "We would love to offer you 4 free hours of nursing care. Here's how it works. We don't run through your insurance. Here's what we're going to do." And you could see the caregivers, the family, like, light up. They'd be so excited, like, "Oh my god, yes, someone's gonna help me." And then the patient in the bed would say, "It's okay. My wife has it. My sister has it. They're amazing. They've got it." And the family would just turn flat, and you could see that they felt like they wanted and needed the support, but as soon as their loved ones said, "No, my family has it," then they felt afraid to speak up.
Mm,
And to me, that was really, really impactful
mm.
because I think as humans, we just kind of are like, "Oh, our family can help us," but we don't really think about what it does to them, right? Like, they're oftentimes afraid and scared, and they don't wanna do something wrong. They don't wanna hurt you, and they didn't sign up for this either, but we're just giving them these huge responsibilities, and, that was really insightful for me to witness, and I think there's a lot more to come down the line with research in this particular space, but we really learned that nurses love this work. They pick up these shifts as they want, and their burnout is significantly different. That's really important because for nurses who work in a hospital, they go back to the hospital caring for people and they're now less burnt out. And we know that less burnt out clinicians provide better outcomes. So theoretically, if they go back to work in a hospital being less burned out, every single life that they touch in the hospital will benefit from this sort of work on the backside. So that was that for me the highlight of what we found. And um, obviously, patients we interviewed them, we looked at data, and all of these patients that we took home, they were like, I just signed up to help you." Like, you just need data. I'm here to help you. But at the very end, when we asked them, now that you've gone through this, how do you imagine going home from the hospital in the future? And so many of them described the hospital should pay for this, insurance should cover this. I can't imagine going home another way in the future. And so we really got to hear and see the impact, but they don't know that nurses can help them outside of the hospital. Like, people
Right.
just think that nurses exist in this square, and we really don't. We function so well in the community, and that's where we can really best help them.
I want to unpack a couple things that you shared
Yeah.
because they are two really important points that I want our viewers and our listeners to hear. First and foremost is the family caregiver.
Mhm.
Thank you for addressing that and pointing that out because they truly are the unsung heroes. You got
100%.
63 million of them that are providing care every single day for loved ones, neighbors, friends, family members, you name it. We have about 17 million of them that are dealing with loved ones that have dementia and Alzheimer's.
Mm.
It's really, really hard work. You got
Yeah.
a chance to experience that yourself by
Yep.
being a caregiver. So you know exactly what that is like. And you know when somebody comes to you and says, I am here to help, and you know that they're qualified being a nurse, you're like, "Whew,
Yeah.
thank goodness." But you can also see the patient standpoint saying, look, my daughter has this, my grandchild is helping, my wife is here, but they don't really understand the stress that a family caregiver goes
They
through. And
don't.
that stress emotionally and physically is so incredibly taxing that they don't really care for themselves. They're putting it all out there for their loved one.
Yeah.
And they allow themselves to deteriorate emotionally, physically, medically, you name it. And that's hard.
It is, and I think you may even know the exact statistic, but caregivers themselves, they actually tend to have more health problems and actually pass before the person they're providing care to sometimes.
The data point is from AARP. It's about 10 years old. And that is couples caring for one another 65 and older without outside assistance from professional companies like yours or mine, or neighbors or friends or family members. And you have to remember this generation now that we're caring for, they took those oaths, sickness and health, literally.
Yeah.
They're like, I got this. But 63% of the time, the caregiver predeceases the care recipient because of those stressors.
Mhm. It's a really astronomical number, like 63%,
Yes.
truly, and I think even when we go back to that verbiage of, like, in sickness and in health is what you care for someone, that's where I think there's not like, it can be interpreted in so many ways. And caring for someone and being supportive of them doesn't mean you have to provide the hands-on care. Being supportive of them could be you're gonna sit down and listen to what's on their mind. You're going to
Mhm.
sit there and hold their hand or go for a walk outside because sometimes that's the most powerful thing you can do for them when it feels like their world is falling apart. Just to be present with them is sometimes the best way you can care for someone. And when you can allow a professional or someone else who's been trained to come in, that's like an enormous gift.
Oh, it is an enormous gift to get that assistance so that you can take care of yourself. And it's all about respite, right?
Yeah.
Because they give up their lives and they no longer go out to lunches with their friends, or they don't go and play tennis or golf or play mahjong or gin rummy. I mean, it's important for them to have their lives. You go to the beauty parlor, get a massage, get a pedicure, a facial, you name it. These are things that life needs to continue on for those individuals. They are the unsung heroes.
Mhm.
We need to figure out ways to help, and Navi Nurses is doing it. So I want to unpack one of the other things you talked about
Sure.
was the nurses.
Yeah.
Okay, so you have 160 of them that are working for you.
Yeah.
These are primarily, and correct me if I'm wrong, they're primarily bedside nurses that work in hospitals.
Yes.
And typically, as she shared before, my daughter's a nurse. Typically, they work 3 days a week, 12-hour shifts.
Mhm.
So they have 4 more days available in a typical week. And this is an opportunity for them to be able to continue to do nursing, to supplement their income, and
Yes.
do something that's really special because now it is one-on-one care and not one-on-many. And in a lot of cases, these nurses that are working in hospitals are working in, you know, critical care units, they're working in ERs, they're working in surgery, they're working in various disciplines that are very stressful.
Yep.
And not that care in the home isn't stressful, but care in the home is a little bit different, only in the sense that it's one-on-one. You get to provide more than just the medical necessities, but you get to be part of their lives. Can you describe this and the type of caregiver, the type of nurse that you're employing? And let's use this show as a platform to recruit other nurses that
Uh-huh.
may be looking for this type of.
Yeah, you're so sweet. So, um, typically, when I think about nursing, doesn't matter what department you're in a hospital and organization, it's stressful, it's chaotic. You don't always have the time and the resources. Things are moving at a really fast pace. People are really acutely ill. By the time when they've gotten to the house, they're what we call stable for the most part, right? Like they're okay to be home. The doctor says you're okay to be home, so they're not as acutely ill. But oftentimes they need still some extra support and guidance and reassurance. So these nurses, like, I actually had dinner with a table of them last night. So we had a patient that we've been caring for the last 2 years, and she passed away. And we brought the whole team together to have dinner and celebrate her life.
Mm.
And just sitting down with the nurses last night and talking to them, sometimes I'm like, am I really telling the story, right? Am I really saying what I'm seeing and just hearing the impact that this sort of work has for them, how it's changed their family life. Like one of the nurses I was talking to last night, her husband had mentioned, "You are so stressed in the hospital. You come home, you don't look good anymore." And so now that she's working for us, she actually left the hospital. She now has time for her family. She's raising two young kids and she loves what she gets to do again. And part of that is a combination of having flexibility. They can pick up the shifts when they want, but they have autonomy. And it's just a one on one connection. And nurses, and I would say all healthcare providers for the most part, we join the profession because we truly want to help someone and we care deeply about humans, just like you do, right? Like people don't enter the caregiving space because they want to do it. They care about other humans and they
Mhm.
want to make a difference. In institutions, you don't always feel like you can. And so when you work somewhere where after 12 hours, the only thing you can think about is all the things you didn't do that day, it can become really defeating. Whereas with this, just an hour-long visit and a nurse can walk out and be like, "Oh my gosh, I did all these things for this person." And it's the person and their family, right? Like you sit down with the entire unit and work together collaboratively. And it truly is a partnership. Whereas in the hospital, it's very much like you're on our schedule, you wear our gown, you do things when we want, and it's very regimented. But in the home, the clients direct the care.
Right.
We're just there along for the ride, and I think that that also shifts things. So we really look for nurses who have at least 3 to 4 years of experience, recently in a hospital because they have to have really developed the intuition, which we know it takes about 5 years, with a nursing expert. It's novice to expert model by, Dr. Patricia Benner. It takes them that long to really become experts and trust their intuition and also have the courage to advocate fiercely for the people that they're caring for, right? Like there is no such thing as a no, right? Like we're going to go after what we need, what we want, and no one is going to tell us otherwise. So, that's obviously what's needed sometimes. So it could just be simple as like we walk into someone's home and we recognize they need to see a doctor, but their appointment isn't for 2 weeks later. So we call and say, nope, they're coming in today. Like they need to be seen today. And when a nurse calls, we can actually usually get them into that appointment a lot faster because we can articulate and communicate what it is that they need. And
Right.
so having someone who feels confident enough to make those calls of like, no, this is emergent, this needs to be seen, that's really important. But otherwise, we're obviously just here in Phoenix. So nurses who are here, we welcome them to see if the culture is in alignment because the culture piece is really important to us too. So treating our clients like family and really being open to practicing independently, which is not something we're usually trained to as nurses because in hospitals it's very regimented. There's protocols for everything. But when you're in someone's home, you finally have the ability to say, "Ooh, let's think about this," or "Ooh, here's another recommendation." And you can really wrap around someone all of the options that they didn't know were possible that we aren't always able to do so in a hospital setting.
Well, I did say when I wanted you to talk about the nurses is how do people that may be watching and listening connect with Navi Nurses? If you're a nurse or you know someone that's a nurse, this is not only, as you shared, a great way to supplement your income and do the work that you signed up to do and provide care for an individual in their home. You can do this as a career too. So how do they connect with you?
Yeah, they can just go to the website. So it's www.navinurses.com. And there's a page specifically for nurses where you can learn more. And if it feels like it's an aligned fit, definitely just fill out an application. And we have onboardings twice a month where we bring in groups of 5 to 10 nurses to come and learn more and join our team.
You know, I follow you on the social media platforms. The one that I prefer is LinkedIn. It's one that I subscribe to and I learn a lot.
Yeah.
I don't think there is a bigger advocate out there for nurses than Jasmine Bhatti. You are fierce as it relates to saying that nurses are really the backbone of the healthcare system.
Mm.
I really, I don't think people realize the importance of nurses. And if you could just take a moment and share with us why nurses matter, because they tend to be the forgotten. Everyone talks about the doctors,
Yeah.
and the doctors do what they do, and the surgeons do what they do, but the nurses are the ones that make it happen. They're the ones that really can have that intuition. They can know when a client, or in this case, a patient, is needing care or needing something different than they're getting presently.
Yeah, and I think it's funny because I've worked with a lot of people in building the business, other business advisors that have nurses in the family and they have no idea what nurses do and they're
Right.
living with one. And I mean, they hear all of our stories at like the Thanksgiving and holiday parties, but I think as nurses, we do a really good job of shielding our patients from things they don't need to worry about. And in doing so, it shields them from all of the work we actually do on the backside that they never even see. Of course, like, we're there to check their vitals, make sure that everything is trending okay the way we want it. We do their assessments to look for, is there a change in their lung sounds or their gait or their speech, or every interaction we have with someone, we're constantly assessing them. Even now, like, I walk down the street and I'm like assessing people. It's just like this thing that you can never turn it off, I think.
Right.
Um,
I
that's
can
it.
only imagine. No, seriously. I mean, I go into restaurants and I see people walking in and I'm like, oh, that person definitely has probably a cardiac issue going on.
Yeah, or they're at
But
risk for fall, right?
yeah, risk for
Like,
fall. I mean, you can see these things.
you can see them. Yep, exactly. And, I think those are the really common things that we hear and see that nurses do, and obviously giving medications. So, we'll do the injections and giving them their pills and organizing their medications. Um, but we do a lot behind the scenes. So coordinating everything. Is the pharmacy filling your right prescription? Is this the best prescription for you? Are your doctors talking to each other to make sure that your medication lists are correct? Are we not, are we overdoing something? Or are we having polypharmacy, which means we have too many pills, maybe because the doctors aren't all communicating? And even the things down to being human, right? So bringing in social workers when they need to, if we have an older adult who's caring for their children's child because there's issues in the family. Like, there's always social determinants of health that we have to think about as well for people. And nurses take all of the components from being human, our family life, our genetics, what's happening in the family, all the way through like what's happening in their life in the moment, where they want to go, and their health history too. So it's this combination of their mind, body, and their soul is what
Right.
we address. So those things combined are how we help guide someone where they should be, or which path they can take. And so, sometimes it may seem silly, like a nurse who's able to provide comfort to someone, just having someone hold your hand while you're going through a difficult procedure, but that's so needed sometimes. Like, someone to just tell you, like, I'm here with you, and someone who knows, like, what's happening,
Right.
it just feels, like, so reassuring when you know that there's someone by you that you trust, and that's priceless.
It is priceless. And you talk about medication management, you talk about transitions, and this is really where you guys hit your sweet spot.
Yeah.
And that is helping people go from an acute or post-acute setting back to home and being able to making sure their medication reconciliation is right on cue and making sure that, the multiple specialists that are needed to be seen are lined up. Those appointments are lined up. I know you also, do accompany your patients on these visits.
Mhm.
I know this because you gave me a free trial when I was dealing with an acute kidney issue. And I got to tell you, I mean, the nurse that you partnered me up with, she was amazing. I mean, she understood exactly what I was going through. She met with me in the waiting room and we actually went to the exam room together and asked questions, which so many patients don't and family members don't. They don't have that advocate. So the medication reconciliation is a big piece, but also the follow-up that needs to be done to make sure that that patient is doing the best they can to thrive in a post-hospitalization situation.
Exactly. And I think the discharge process is the most fragile one that someone can go through.
100%.
And it's like you've spent this time in a hospital or a rehab, and all of a sudden it's time to go. And you're used to having people 24/7 being there to help you in an environment that's not your own. And all of a sudden you go home and you're given a stack of papers, like a stack of papers, and you're probably on medication, you're sleep deprived, you're overwhelmed, you're exhausted, you just want your bed. So you're not really paying attention to everything, and your family is like overwhelmed just as much. So when you get home, it's like, oh God, I'm home. And like reality, it really sinks in. And then you start to encounter your problems. Like the physician forgot to sign your script, so the pharmacy can't fill it for another day or so. Can you risk not having this medication for the next 2 days? Or worse yet, you get there and the medication is extraordinarily expensive and you can't afford it. So do you just not take it, or can we work on finding a different one for you? But we also find too, in the hospitals, it's not a perfect system. We have different levels of the physicians. So there's usually like the residents and then there's the attendings, but in between there's different levels of residents. They're always changing all the time. So the resident who's probably signing off on your discharge orders, it's probable that they may not have even seen you before. Like they've just come on for the day and they're now in charge of writing your discharge orders. And they didn't know that a few days ago you had like low potassium and we didn't address that in your discharge. And
Right.
so there's always these little things that happen that if someone has a huge list of medications they're taking, it adds a lot more complexity to, are we really making sure they're getting discharged on the right things from the hospital perspective? But then you have to now make sure you get in to see your primary care, which some people are waiting 2 to 3 months for. And the goal is to get you back into your primary care within 7 days
100%.
because we want to make sure that those medications are actually like something that your primary care, who knows your history and who knows like what they know everything about you, right? If they've been caring for you for a while, they're best positioned to help streamline and organize your medications. But people can't wait 2 to 3 months to be seen by their primary care just to make sure that this is okay. And so we tend to see that there's certain time periods where people get readmitted from the hospital at. That's one of the things we saw in our study. They get readmitted around day 3 and 4 and they get readmitted around day 11 again. So these things are happening in patterns and it's usually really close to the time of discharge. And it's because they didn't get the things that they needed, or there's no follow up, or there's, sometimes complications that happen as well. But where do they go back to? The emergency room, right? Where a lot of the times having a nurse can actually help prevent the readmission. We can just call into your doc. Here's what we're seeing. Here's what we need, and get everything brought to you. Bring the labs into you. Bring the
Right.
imaging into you.
100%.
Skip the emergency room, and let's get things going from there.
I mean, you should only be going to the emergency room if it's really an emergency, like you're in life-threatening, situation, dealing with it.
Yeah.
You talk about discharge. So I am guilty of exactly what you just described. So I had a hospital stay almost 3 years ago, and for me, when I came home, I got the discharge packet. I remember throwing it on the island in the kitchen, and I went back to bed.
Yeah.
I woke up the next morning and I looked at my discharge orders and I was like, oh, I was supposed to do this. I was supposed to, get this prescription filled. We didn't do any of that. So, I mean, the discharge process can be very, very cumbersome. It can be very awkward. It can be very disconnected.
Yeah.
So it's really important to make sure you follow those. But having a nurse help you through that is so much more beneficial.
Yeah. And it just helps take off the stress. And ideally, our rule is we want to help you through these really critical periods and um, get you to a spot where you're back to being independent. Or if we can wean away, get you through like those really critical time periods. And then caregivers can step in with more of a presence. We take more of a back seat. So that's like how we get to collaborate too, is start off strong with the nursing side, then bring in the caregivers and let you take over and resume care. We just kind of provide the oversight and work in collaboration with you to make sure that we're working as a team and getting people what they need.
And that's what I love about the relationship Cypress Home Care has with Navi Nurses is that Cypress Home Care Solutions does engage Navi to do those clinical things that we cannot do. So
Yeah.
whether it be passing medications, whether it be medication management, whether it be an IV therapy, you name it, the partnership that we have with you is something that we really appreciate and honor
Oh.
and really respect the fact that we can do this for our clients.
And likewise. Thank you.
So I want to talk a little bit about entrepreneurship.
Okay.
Okay.
The
So
fun stuff.
we know why you did do this. So, for me, one of the things I want to ask you is looking back at it, what was one of the hardest things about being a founder?
Oh my gosh. I have to think about this for a moment because there's a lot, right?
Sure.
There's a lot of different things. And now in hindsight, I see how, although they've been difficult, they've been really important for me to get over because there's bigger problems ahead. There's more things. It doesn't ever stop.
Right.
But I think in the very beginning, one of the hardest things for me was walking in a room and having people take me seriously. They were like, "Oh, you're just a nurse. You're just cute and bubbly. Like, you know nothing about business."
Right.
And I was just like, "Okay, but I know what I'm doing. Like, I see the problem. I know how to create a solution." So I think that's one of them. And you know, I think the second biggest thing is just like having the courage to start it. Like, having the courage to get up and going itself is probably the biggest thing, but once you get over it and you're like, "Okay, I'm putting my mind to it," I am a firm believer in writing down your goals, looking at them all the time. Like, I feel like that's really helped me manifest exactly where I'm at today. Like, I have really clear goals. Here's where I wanna go. Here's what I wanna do. Here are my KPIs. Here's what I'm reaching towards. And when I look at that, then the magic is in how do I make that happen? And I've just had to sit back and have faith in God and have faith in the universe that I'm gonna get there. I
Right.
just don't know how.
Well, you had validation too. You had people like Rick Hall and others saying, "You got something here, kid.
Yeah.
Let's see what you can build." What was the one thing that you would say that you underestimated when starting the company that you look back at now and said, "Wow, this was really hard. I underestimated this piece."
I underestimated myself, honestly, the most. I think in the beginning, everyone wants to give you advice and everyone wants to tell you what to do because you've never been there before. And I started to take advice from people that I don't know if it didn't help me, but it taught me that I need to rely on my own intuition. And I say that because I've had to hire people for roles I know nothing about, nothing. And my tech developer, for example, he's built 3 AI companies and sold them. And I remember interviewing people when I was looking for this person for this role, and they all had incredible experience. I couldn't look at code and tell you if it was good or bad for the life of me, right?
Neither could I.
There's like it's not my realm. But when I met Jason, I was like, "That's it. Like, he's the person. I have to have him. Like, he's the person to build my technology." And I underestimated up until like about that point, about a year ago, how important my own intuition is. And I think that's really key. I think founders that deeply understand their problem, they know exactly what they're looking for, and they can really listen to themselves if they tune everyone out just a little bit and focus on what they're feeling. I don't know if that answers your
No,
question.
it does. No, it really does. I mean, look, as founders, we all feel the the doubts, that we start questioning ourselves, but we have to rely back on why we did this
Mhm.
and feel really good about that. I love that you've discovered that. My next question to you is what part of entrepreneurship came to you really naturally?
I think there is a combination actually of 2 things. And I say this all the time because I think the Girl Scouts organization is amazing, right, for so many reasons. But being a Girl Scout at a young age taught me to go knock on doors, sell Girl Scout cookies, take no and be okay with it. And I think because of that experience, it has helped
Oh,
me
I love that.
from, like, a sales perspective
Sure.
and just, I'm gonna go for it, and I don't care if people say no, like, I'm just gonna keep knocking on doors and doing the things. So, like, I think that to me is, like, a great example of, like, how it made, I think, entrepreneurship feel easier for me because I'd kinda practiced it as a child
Hmm.
when I felt like nothing could really stop me. So I'd probably say, like, that sales part, but then also, as much as I'm a nurse and I'm very, like, empathic and I care, like, there's a very, like, nurturing part of me. I'm also very scientific minded, and so being able to blend those 2 together, looking at data, looking at numbers, like, that comes very easy to me. So I think that's another big part of it. Yeah.
No, I love it. So what part of it did you learn the hard way of being an entrepreneur?
Oh, managing people.
Mm.
Yeah, that's really, really hard. Managing people has been a learning experience
Mhm.
for me because I don't know, for me, at least I just assume that almost everyone has like good intentions and they really want to come and work hard. And I didn't realize the importance in the beginning of really making sure you're holding people accountable for everything. Like, I don't like being a micromanager. I want to be able to tell someone, here's what I need, go and do it without like, like micromanaging them. But I realized that it's important to have like accountability for them and they need structure. And I've like never really had structure in my own life. So having to create it for other people and myself that's been a learning experience for me.
And managing people is hard.
Mhm.
So if you had to go back and to the very beginning of Navi Nurses, what advice would you give yourself?
It would just be honestly, just keep going. Like, you've got it, just keep going. Because there's a lot of things that happen along the way that make you question, like, am I a good leader? Am I doing this right? Am I on the right path? And I don't think that there's something I don't think there's such a thing as right or wrong. There just is.
Hmm.
Whatever path I've taken to get here, I can't change. I can only learn from it and go forward. And if I keep that same mentality, then it just keep going. And that's all you need. You'll get to where you need to be if you just keep going.
Just keep on going.
Yeah.
Keep moving.
Yeah, just keep moving.
That's right. No, I love that. So healthcare is shifting rapidly and it is moving to the home. And I often say that I see a future where home is going to be the center of care. What role do you see Navi nurses playing in this?
Yeah, I mean, I think just as you said, like hospitals are really meant to treat acute episodes of care where it's like emergent and they need to have something done. But the rest of health should be experienced in the home. And nurses are great for not only helping people move more in a preventative healthcare model, but also in the maintenance and the supporting phase when someone is going through something. And what we both see and know, Bob, is that people thrive best at home.
Mhm.
And that's where care should be delivered. It's where they're receptive where they can listen, where they can participate, and where they can actually integrate in real time using their own environment. Like, let's go through the kitchen, let's go through like your environment itself. All of those things matter. And nurses and caregivers and therapists and everyone else that like they currently exist sometimes in other institutions, when they can be brought to the house, that's where people feel safe,
Hmm.
and it's where they're going to um, thrive best.
Couldn't agree with you more.
Yeah.
People, are mistaken even to this day. They think hospice is a place and they don't really realize it's a concept.
Yeah.
And 98, 99% of the hospice care is delivered right in the home.
Yeah.
And that's where it should be. That's where people want to be.
It's where they want to be.
So you mentioned Jason. He's your techie guy.
Yes.
Okay. So, technology is reshaping the world. Obviously, AI is all over the place. I think it was even Time Magazine Person of the Year. Um, how do you see technology transforming the way nurses are delivering care at home now and into the future?
Yeah. So I think in the healthcare space in general, it has a tremendous impact on how we can reach people and how we can provide more accurate and timely diagnoses and treatments. And that's incredibly important. So, ideally, for nursing care, what that means is we can do a lot more faster. Um, I don't think that it ever replaces the value that human beings provide, right? There are certain things that for us as nurses, a lot of our clients hire us for things like IV antibiotics. We're giving them medications. We're giving them their tube feeds. We're doing their assessments and monitoring them. We're doing physical work with them. Those things can never be replaced by AI. Yes, you can have someone who like pops up on a screen and walks people through the processes, but that means that the person and their family still have to want to do it. Sometimes they're too scared and they don't want to do it, and that's okay. So I think for nursing care, it's going to allow us to um, ideally have more time with people and catch them at different phases that maybe we didn't catch them at before, right? So if earlier diagnostics, we can work with them in different ways because their condition is caught at a different time period. And it maybe extends times that we can work alongside them through their journey. But the act of caring, it's so deeply human. There's no robot, there's no
Hmm.
AI that can replace a human touch and presence of a human who will be present with you.
It's interesting. You talk about, data earlier. Data analytics is so important. And we can capture a lot of that data. Your nurses capture this data, right? And even home care agency, caregivers are capturing a lot of the data for you. But that's really where I think the game changer is. I agree with you 100%
Yeah.
that, nurses are intended to be relational with their encounters with their patients. And that's the way it should be. It should always be.
Yeah.
But behind the scenes, it's capturing that data, right? The data upon discharge and accumulating the data after discharge to see the variances and to see an anomaly and predict and protect that patient from going back to the ER.
Yeah.
I mean, it's the proverbial, what I call the win-win-win. It's a win for the patient and their family. It's a win for us as providers because it's our goal to keep them where they are. And it's also a win for the acute provider or post-acute provider. And the fourth one being the health plan. The least costly place for someone to be
Mhm.
is in their home,
Oh,
where
100%.
they want to be,
Yeah.
where they truly want to be. We talked about that discharge, and really, I would love for you just to expand a little bit upon this before I go and open it up to some rapid fire questions so
Okay.
we can really see the human side of Jasmine
Oh
Bhatti.
gosh.
But
Okay.
really, I'd would love for you to describe the fact that I am a patient engaging Navi nurses where I have had an extended stay in an acute or post-acute setting, and that discharge, why is that impactful and meaningful for me to have will call my Navi nurse a guardian angel beside me as I come home.
Yeah, and actually, I wanna kinda take a little bit of a step back too and talk about, like, why it's important even in the hospital.
Yeah.
So we have clients that hire us to be a second set of eyes and ears who are unbiased while they're in a hospital, and there's a really important statistic that I wanna share that most people don't know about. There's research that's been done for years, across the world, actually, and it sounds very intuitive, but there is so much research behind it, and there's actual numbers that translate to meaning. So nurses on like a medical surgical floor. So these are going to be people that, maybe they have an infection, they're getting IV antibiotics, they have pneumonia, they just had a simple like like a surgical procedure, um,
Hospitals call it med surge.
med surge,
Med
exactly.
surge, yeah.
Yeah. So they're there for procedures, monitoring, that sort of thing. What the research by Dr. Linda Aiken shows is that you ideally want to have a nurse taking care of 4 patients at a time. For every patient more than that a nurse sees, every single one of those patients has a 7% increase of dying in the next 30 days. So what that means is in hospitals where one nurse on a med surg floor is taking care of 8 patients, that's 8 people. So
Wow.
7, 14, 21, 28%. All 8 people have a 28% chance of dying in the next 30 days.
Wow.
And that's just
Seriously.
100%. This has been research replicated around the country, and people don't understand. So, the presence of nurses in the hospital, their ability to be present with you, track what's happening with your vitals, watch for any changes, it makes a difference significantly for whether you live or die in the next 30 days. So, a lot of families hire us to come in. We bring in expert nurses who have the amount of training. They come in maybe for an hour or so. What's happening? Monitor the person. Are they getting what they need? How do we help expedite things so they can get out faster? So that's one place where we love to come in and help. Let's make sure that someone gets through their hospitalization as quickly as possible and getting everything that they need.
You,
That's the
I
first
use
part.
that term guardian angel. I mean, that is a case in point where if you have a complex condition, you want to engage a nurse. Like you said, they're not going to be bedside for 8 hours. They're coming in for like an hour.
Yep.
And they're gathering all the information, the intel,
Yep.
to make sure everything is in place so that you can discharge and come home safely.
Exactly. And that's increasingly more important as we see more experienced nurses leaving the hospital. So, what we're seeing in hospitals is that we have a lot of experienced nurses who are leaving. We know that there are a lot more planning to leave over the next few years. We have newer nurses to practice, and they're still learning. It doesn't mean that they're a bad nurse by any means. It just means they haven't developed the intuition. They haven't managed like the complexity of the hospital working environment enough so that they can really provide the best care possible to people. It just
Mhm.
comes with experience, right? Like
Right.
it's not their fault. But we're seeing more of the newer nurses, and what that does is it makes it harder for people to receive the very best care because they really need a mix of experienced and newer to practice nurses that can help them get out faster. So we play a really big role with their hospitalization. And then if we can be part of their hospitalization process, it helps us get them set up for success at home. So when home care is being ordered, when they're considering are they bringing on caregiving, what are all the things that we can help them with while they're hospitalized so we can make sure that they're out of the hospital as quickly as possible and freeing up that bed for someone else who really needs it, right? That's really important, but we're also able to get them set up for success in a way that they're not going to be coming back. Are they getting the right equipment? Are they going to have all the supplies? Do they have the right people on the team? Are there any therapies that we are missing that we haven't considered? And really like helping support them. And that first like 10 to 12 hours is so critical.
Mm.
And that's where we want to be present because you've been used to getting in and out of a bed in a hospital. What's it like now? Is your bed higher or lower? Is it close to the bathroom? Like all of these things matter when they go from the hospital environment to being back home.
And I think the one point I want to point out too is don't wait till right upon discharge. The connection to Navi nurses is a connection you should make upon admission.
Yeah.
Upon admission so that you can make sure your stay is is as limited as possible, because you should only be going to the hospital unless it's life-threatening reasons, because you can get a lot of this stuff in your home. But two, to be starting to plan what that discharge is upon admission, and what that's going to look like.
Yeah, exactly. And I think one of the best ways to do that is for someone to just engage the social work and the case managers in the hospital and learn about what resources there are available to them and their family members, and just having really open discussions as a family together. Like, can we do this? What sort of support do we all need to help get their loved one home? And it's going to be give and take for everyone. It's not going to be perfect, right? Like, sometimes our parents are just stubborn and they're like, it's okay, we want to do it, and they want to be so independent, and that's great. It's wonderful. We'd love that. But sometimes we, the family, needs more support, and they have to be willing to let us come in and willing to just accept the care that is there to really help support them and the
Right.
family, and know that it's okay. Like, it's okay to have a little help, because the goal is to get you better faster. And if they can just see that that's where we want to get to together and we can make that happen as a team, that's really, really important. So having those just candid conversations about, like, I still have work and I can't be here all the time. So I have to make sure there's someone that comes in to help when I'm not here. And so it really is like a compromise for everyone in the family. Like, what can we do together?
Oh, I love it. No, and I think that's a great jumping off point, because I really think that is a place where things just don't go really well.
Mm.
And it's upon admission, discharge, and like you said, get together. If you're a family member of a patient that is being in the hospital, get together with social workers, talk to the nurses.
Mhm.
You got to have a conversation with them.
Yeah.
And if you're looking for additional help, then you want to reach out to Navi Nurses, so that at least you can have in plain English talk what's going on. And most of the people that are in these facilities, in these acute settings, they're there for multiple complex reasons.
Yes.
So it's not just a simple thing. You know, one event affects every other organ in the body. So there's definitely issues that happen that are very complex for the lay person to really understand.
Yeah, and the thing that people don't realize is that if you end up readmitted, within a short period of time, every time someone leaves the hospital, they've probably lost some muscle mass. They have not been sleeping well. They're deconditioned as a whole, and they're probably leaving more frail. If they go back to the hospital within a certain time period, then it puts them at, like, more risk for being even more frail. Every subsequent readmission, especially for an older person, leads them to being more frail than the time before, and we want to prevent that. But part of that is asking for help and knowing that there's help out there that can make a really big difference for them through organizations like Cypress and our own.
It's interesting. A data point that was shared with me before is that for every day you're in the hospital, you lose 1% of your muscle mass.
Yeah.
So if you're in the hospital for 10 days, you've lost 10% of your muscle.
Yep. And that's partly because of nutrition, whatever's happening to you, you're not getting up and walking, right? So all of those things are like areas where it may not sound like it's important, but having a nurse come in and making sure that you're getting up and walking every day, that you're eating your food or bringing in other food for you, those things make a really big difference in how you recover, not only in the hospital, but even when you get home.
Let's have some fun.
Okay.
Let's see the human side of Jasmine.
Oh,
I'm going to
God.
put you on the spot because I have not prepared you at all for this.
No, it's okay.
So if you want me to skip and get to the next one, I can do that as well.
Let's do it.
All right. So what 3 words best describe Navi Nurses?
Oh, Navi Nurses. I would say we are generous, compassionate, and trustworthy.
One quality every great nurse must have.
Compassion.
Coffee or tea,
Tea.
beach or mountains,
Ugh, beach.
hospital or home care. Where does the future lie?
Home care. Yes.
I know I expanded on this before, but a leadership lesson you've learned as a founder.
Follow your passion and the success will come.
Love that. What is the most rewarding moment you have had since starting Navi Nurses?
Oh God, there's been so many. Um, at our Christmas dinner on our 3rd year of being open, I had a husband of one of our nurses come up to me and he was crying and he said, "I've never seen my wife so happy." And to me, that was like so touching because all this time I thought about how much it impacted patients and I thought about how much it impacted the nurse directly. I never thought for 1 minute how much this was affecting the family, their kids, their husbands, their wives. And to see how much of an impact it's made for them, like, it's just priceless.
I could see how emotional you get over
Yeah.
that. It's so raw and so real,
Yeah.
so authentic. Thank you.
Mhm.
One myth people believe about nurses.
Oh, that we just follow orders. We don't just follow orders, we actually help create them.
What's your favorite way to decompress after a long week?
Ugh, floating sound healing is my favorite. Floating in a pool, on a mat, listening to sound bath.
Oh, I love it.
Mhm.
Do that in the winter too?
I don't really do it in the wintertime, I just do it inside at home, but yeah.
One innovation that will transform healthcare in the next decade.
Oh my gosh, there is I think just like OpenAI and just like ChatGPT, Claude, like Claude is my favorite. She's who I use. But I think just all of this information and accessibility to everything is going to change healthcare as a whole.
Finish the sentence. Nurses change lives because.
Lives matter.
Jasmine Bhatti, I can't believe that we've done another show together. Is there a question I haven't asked or a lasting thought you would like to leave our listeners?
Oh my gosh, you're so sweet. It's been an honor to be back again. I think for me, the one thing I wish people would know is that it's okay to ask for help. It's important to ask for help. And it's okay if you don't know what the help is that you need. Just asking someone somewhere will help lead you to the care that you need, whether it's nursing care, whether it's caregiving. Help is so important. And I just hope you understand that you have permission to ask for it.
Uh, Well, it's been incredible watching you grow over these past several years from an idea that was inspired by your grandmother
Yeah.
to creating Navi Nurses and transitioning from a hospital setting to a home setting. Um, Knowing you like I have over the years and serving now on the advisory board for the Heal Lab and watching people like yourself come to us with these ideations, these ideas, and really helping mold them and create our future founders of new solutions for so many of us here in our community. It's a great honor to have you here with me at Health Future and have you as my friend. So,
Thank you.
for our listeners and our viewers, thank you for joining us here on Health Futures. Jasmine Bhakti, it's such a pleasure to have you here. Thank you for our listeners and viewers. Stick around. We'll be back next week with a future guest. Take care. Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.